sometimes we call it as black asthma also because it causes blackening of the lung. And the symptoms are very similar to that of asthma. Roughly around 30% of smokers do go on to develop COPD. There is a large amount of data now that suggests that passive smoking or second-hand smoking in the household increases the risk of asthma in children or increases the risk of COPD.
Hi guys, this is Minidevan and you're watching HealthSite and India.com. Today we have with us Dr. Puneet Khanna, Head of Respiratory Medicine, Manipal Hospital, Dwarka. Hi doctor, how are you?
Hi, good morning. How are you?
I'm great, sir. So as we all know, today is World COPD Day, which is Chronic Obstructive Pulmonary Disease. So the very first question that I want to ask you is, what exactly is this disease?
Okay, so COPD, as the name suggests, is a chronic disease which causes obstruction in the lung. And worldwide, this disease is quite prevalent. And if you ask me, in last 1 decade, this is the only chronic disease that is increasing. Whereas if you see the cardiac diseases or the other diseases which are chronic like diabetes and others, they are showing a downtrend because of healthy lifestyles. But unfortunately, COPD, or what we call a chronic obstructive pulmonary disease, this is the only chronic disease that is increasing in incidence. And partly the reason is that the smoking as such has increased in the younger population as well as in females. Also, COPD is caused by other pollutants like increased air pollution, environmental tobacco smoke, household smoke, use of firewoods. So all these factors which when they impair the lung, it causes a disease called COPD. And sometimes we call it as black asthma also because it causes blackening of the lung. And the symptoms are very similar to that of asthma. So it is also known as black asthma.
Okay. So since we are talking about, how pollution also raises this disease and increases the intensity of the disease, with current scenario, currently pollution levels are severe. It's the AQI is on the worst level possible. So how is it currently affecting the whole situation? Are the cases on a rise?
Yes. So like every year during this time of the year, what we normally see that there is almost an increase of about 25 to 30% people coming to our OPD and getting admitted for lung-related diseases. And chief among them is worsening of their COPD and asthma. This is directly correlated to the level of pollutants and the level of pollution that you have in the air. So as the air quality worsens, we see a large number of elderly COPD getting admitted for breathlessness, chest pain, and worsening of their COPD in spite of taking medications regularly. So this is kind of a routine thing that we see every year, and it is quite directly related to the level of pollution that you have in the city.
Okay. Also, what are the early symptoms of this disease? Is there anything that, a patient from their end can identify with?
Yeah, so unfortunately, this is one disease that hits you the most once you enter into a middle age or an advanced age. The earlier symptoms usually are persistent cough, breathlessness while walking short distances or while climbing stairs, excessive sputum production, clearing of throat repeatedly, or chest tightness, or increase in their blood pressure. So all these symptoms point towards early manifestation of COPD. It is very important to understand that roughly around 30% of smokers do go on to develop COPD. But of the people who get COPD, 95% of them are smokers. So this is very, important to understand that some people say that many people smoke in my vicinity, but they do not get COPD. So that's because they may have a genetic tendency for COPD in some patients. But of all the people who eventually get COPD, 95% of them are smokers. So those who are smokers and if they have these symptoms of chest pain, cough, breathlessness, or excessive sputum production, they should get themselves screened for COPD.
Also, apart from the generic pollution and the smoking, are there any other causes that can lead to this disease?
There are other factors like indoor pollution, and sometimes we see in rural women COPD developing because of use of those firewood for cooking purposes, or use of people who are staying near chimneys, or people who are staying near the industries which emit a large amount of air pollution. So all these patients also do go on to develop COPD. So it's not just the smoking itself. Rapid industrialization also, and areas where there is large amount of construction activity going, those areas also, people around those areas also do go on to develop COPD.
Also, sir, it's commonly said that COPD is on a rise in children as well. Firstly, is this true? And if this is true, then why is this happening?
One, there is a large amount of data now that suggests that passive smoking or second-hand smoking in the household increases the risk of asthma in children or increase the risk of COPD. And also, the indoor pollution, particularly use of mosquito coils, repellents, agarbattis, and fumes in the house, they also increase the incidence of COPD. And it has been documented in many studies that those cities who are heavily polluted, there also the children are getting affected more commonly with respect to their asthma and COPD. So all these factors are there, and we see an increase in the number of cases in children also.
So, say any prevention tips that an individual can follow from their end to prevent this disease?
Yeah, so prevention is the first and foremost is to avoid smoking and avoid exposure to second-hand smoke at home also. The second thing is that wearing of N95 mask, particularly during the time of pollution, is absolutely important because that goes a long way in preventing the disease. The harmful effect of pollution are mitigated by wearing a proper tight-fitting mask, particularly during peak hours. And the third most important thing is to maintain immunity in a very normal way. And the person who is suffering from this disease should take proper diet rich in minerals and fibers and fruits. The other thing which has been directly correlated with this is use of vitamin D supplements, and they are also known to cause prevention against COPD as such. So these are some factors which go a long way in preventing somebody from getting a disease like COPD.
Okay. And in terms of treatment, if somebody has already acquired the disease, what is the treatment process like? Is it treatable? Also, are there any newer advances in the treatment?
Yeah, so now the medications are quite easily available, and they are quite good also. The first and foremost thing is to contact your chest physician and undergo a lung function test or a pulmonary function test, which tells us about the condition of the lung and whether you have COPD or not. Once the diagnosis is done, then you can go ahead and take inhalers and medications which are to a very large extent improve the quality of life and reverse the disease to a large extent. You cannot completely cure the disease because once the damage happens, there is bound to have some repercussions, but you can control it and maintain a very healthy lifestyle with adequate medications, including inhalers and emergency medications. Only rarely do you require, admission or oxygenation on a long-term basis in such patients. But if detected early, then this disease can be managed very well in the initial phase.
All right, sir. I think this has been fab. Thank you so much for your valuable insights. I think the audiences will go back home with lots of information. So thank you for that.
Thank you, Meenu. Thank you so much.